My name is C. Anthony Kim. I'm a surgeon here in Puyallup, Surgical Consultants, and I've been in this region for 20 years now, and my expertise is in laparoscopic surgery, minimally invasive surgery, with interest in anti-reflux surgery. Well, over the years there have been many developments in anti-reflux surgery, and one that we use the most is what's called a Nissen fundoplication, where we use part of the stomach to form a new valve at the end of the esophagus. That is a very good surgery, but does have some limitations and some problems. And now there's been this ingenious device actually that they've come up with that provides that extra valve effect at the end of the esophagus without some of the problems that the Nissen fundoplication has. It's actually an ingenious device. It's a ring of magnets connected together independently, so they slide over each other, and it wraps around your esophagus, and it causes the actual little valve effect. But it's not so strong that it prevents swallowing. That when you do swallow, the food can go through the area, but then it closes right back up. There have been many procedures and devices that have been developed over the years in combating reflux disease, but they have all been proven to be ineffective, too costly, not long-lasting, or too difficult to reproduce in clinic setting. But beauty of this device is so simple. It just provides a little bit of pressure around the esophagus, but also allows the esophagus to function where it's supposed to. Anyone with reflux disease can benefit from this device. However, we have been very careful in progressing its uses, so we have been limiting the patients who have small hiatal hernias, no major complications arising from reflux disease at this time. But there are studies going on where it is applied to people with bigger hiatal hernias, paraesophageal hernias, even people with Barrett's esophagus, which is a condition in the esophagus that can happen after having prolonged reflux disease. But right now we're limiting to people who have generalized reflux disease. They can just use a little bit of extra valve effect around their esophagus to stop the reflux. Well, general workup for looking into the LINX device placement is our traditional workup for reflux disease. There'll be some tests that are required to do. We got to make sure that the esophagus works well, that it can push through the extra valve that would be placed upon there, and that is same as any other surgery that we may do for reflux disease. Generally, endoscopy is required. Make sure there are any other problems going on in the esophagus and the stomach. And we do have to prove that you have reflux disease, that there's excessive amount of acid exposure in the esophagus. We have various tests to prove that. And once that is all done, then we can talk about what is the best procedure to do for each individual patient to go forward from there. If you'd like some more information, you can go to the website for the LINX device, as well as for other procedures for anti-reflux surgery.